a normal cell in abnormal conditions can become a cancer cell. So these inciting mechanisms are the body and the cells are acidic.
Welcome back to the Health Longevity Secrets Show, where we push the limits of human potential and unlock the secrets to our health and longevity with your host, Dr. Robert Lovekin.
Today, Dr. Leigh Erin Connealy, a leading integrative oncologist, exposes the hidden dangers of cancer, mitochondria, toxins, stress, parasites, even cellular voltage. Her new book, The Cancer Revolution, is a blueprint to prevent and heal cancer in ways that mainstream medicine hasn't caught up to yet. Trust me, you don't want to miss this episode.
And now, please enjoy this week's episode.
Hey, Leigh Erin, it's great to have you on the program. Welcome.
Great to see you again, Rob.
Yes, I'm so excited about your new book, The Cancer Revolution, that's coming out. Actually, it will be out just a few days when this podcast is out. So people hopefully run to get it on Amazon or Barnes & Noble or local bookstores, wherever. And but before we dive into that, since you haven't been on the program before, would you mind just taking a moment and tell us a little bit about your background, your journey, and how you came to be in this space?
Okay, great. Yeah, it's always to understand the why someone does what they do. So I was born in Texas, and I am number 3 of 6 children. And when my mother was pregnant, she started bleeding, and she went to the doctor, and they said, oh, we have a drug that will prevent the bleeding and prevent miscarriage. And that drug was called diethylstilbestrol. So that was a drug used to prevent miscarriage and stop bleeding in pregnant women. And that was used for 40 years, probably up until 1971. And so my parents, when I'm a teenager, my parents received a letter stating, oh, you had been administered that medication. The consequences of that medication are, anatomical problems, hormone problems, infertility problems, cancer in both male and female offspring. You need to go to a cancer institution. Well, I lived in Texas. The largest cancer institution in the world is actually in Texas, and more specifically, MD Anderson. So I started going to MD Anderson when I was a teenager, getting evaluated. And so that kind of catapulted me into where I am today. And so the consequences I had were, I had dysplasia. Dysplasia is abnormal cells. Okay, they're not quite cancerous. I never had 2 periods in a row in my life. I had to use very special infertility specialists to have my babies. I had 18 hours of back surgery to reverse the scoliosis that I had, and a few other detours and curveballs along the way. And so it made me look at really the human frame differently. And so when I went to I went to college, got a degree in biology and Latin, and then I went to medical school in Chicago, went out to Harbor, UCLA, and did my residency. And even then, I was trying to change the way we were doing things, because I was doing delivery of babies my first 60 days of residency, and I was doing my resident told me I needed to do an episiotomy, and my first episiotomy repair took 4 hours. And I'm like, no, I cannot do this. I've got to learn a way to avoid episiotomies. And so I said to myself, okay, what can I do? I started researching, looking, and I'm like, you can talk to the patient, have them breathe, and massage the perineum. And I never did a episiotomy again. And I delivered all these babies without cutting them. And so I grew up really natural, eating liver and sauerkraut and all the things that are fashionable today. That's how I grew up. And I started my practice 39 years ago, teaching people how to eat lifestyle medicine. I hired a registered dietitian, and she was, helped me with helping teach people how to eat. And then I took a metabolic approach to people's weight loss. And so anyway, that started my process to where I am today. And how I got into cancer is I wanted to prevent cancer on myself. And so luckily I met this gentleman who had been diagnosed with sarcoma, and this was about 28 years ago, 27, 28 years ago. And he was at they have anti-aging conferences, which you may have been to before. And they had this conference and he was in his booth and he's telling me his whole life story about how he had sarcoma, which is a tumor of muscle and bone. And they told him, you need to amputate. And he says, no. And he spent the next 11 years on a discovery odyssey, figuring out how to save his leg and cure himself of cancer. So I said, oh, I need to learn everything this guy knows. And so fortunately, he told me everything. I learned about mitochondria. Nobody was talking about mitochondria back then. I learned about coffee enemas. I learned about the bioenergetics of the body. I learned about herbs. I learned about so much. And fortunately, this gentleman lived in Sarasota and he'd come and see patients with me. So I started this journey a long time ago. And then I worked with an oncologist and I loved him. He was just so great with my patients. I said, hey, would you be interested in opening up an integrative oncology practice? He said, sure. So we flew to Mexico to look at a clinic with Dr. Contreras at Oasis of Hope. And we all worked together. And that's what we started here was Oasis of Hope in United States. Well, then nobody wanted to go to Tijuana. So we parted paths. We're still very good friends. In fact, I just saw him a couple months ago. And that's what birthed the Cancer Center for Healing. So we have two clinics, the Center for New Medicine side and the Cancer Center for Healing side. And so when patients have been diagnosed with cancer, they go to the Cancer Center for Healing side. And then the Center for New Medicine is human optimization or longevity, because that's more of the buzzword today. But human optimization, longevity, autoimmune, Lyme disease, mold, all the chronic disease, diabetes, hormones were, probably the best in hormones. So any chronic disease, but also if you just really want to prevent and optimize your system. And so it's like the perfect combination because we're medical. So we combine the best of conventional with the new updated things that are on PubMed now, like pulsed electromagnetic field, which has been around for a long time, has over 1,000 PubMed studies, but a conventional doctor knows nothing about it. Right? Like you mentioned ketogenic. Ketogenic was first utilized for epileptic patients. Well, now on patients who are pancreatic cancer and glioblastoma, that's the first thing I do, but that's not the only thing I do. Okay. And so we do a very exhaustive analysis, one, to prevent disease. And I tell people the top three killers are medications and errors. Johns Hopkins produced that study. And then heart disease and cancer. And so you want to not have the top three things, right? So I focus on prevention and optimization, but patients, sometimes they don't know about it. Like I had a nurse today, she says, oh my God, I should have known you 20 years ago. And so she has lots of, she's a textbook case. She has B-cell lymphoma, but she has 10 other very serious medical issues. And now she's a nurse and, COVID made her awaken and see, other ways of taking care of you. So we combine the best of conventional. So, you asked me earlier if we do CT scans and all that. Yeah. So we do lots of blood work, way more than the conventional doctors, because we know the blood work we need to order. And then we do imaging, all kinds, whether it's whole body MRI, CT scans, ultrasound, all those things. But we also do a very detailed analysis of your nutrition, heavy metals, microorganisms, viruses, bacteria, fungi, and parasites, toxicity, all the things that interfere with the body's functionality and healing capability.
Wow, I have to say, your congratulations. Your program is one of the leading, if not the leading, functional integrative medicine practices that I've ever seen. It's amazing. And today we're gonna focus on cancer and your new book. But I just want to shout that out, and we can talk about the overall practice a little later. But just starting off the fundamentals of cancer, like when I went to medical school, cancer was viewed as a disease of genetics, basically mutation, not hereditary necessarily, although that plays a role, but basically the theory of the origin of cancer was gene mutations that drove cancer, and then today we're seeing ideas, a second model based on metabolism, which is not new. You know, Otto Warburg famously did it early on, but it's the idea that there are metabolic abnormalities, you know, in the mitochondria and elsewhere that drive cancer. And if you look at cancer, you can see they're both genetic abnormalities and they're metabolic abnormalities. No question about it. I guess the question is, what's your view on that? And which is primary and which is secondary? What's the root there, do you think?
Yeah, that's a great exploration because you're right. You mentioned Otto Warburg, who got a Nobel Prize 100 years ago, that said that cancer is a interruption in typical metabolism, for fancy words, oxidative phosphorylation, the Krebs cycle of energy. And so a cell is there minding its own business, but we're being bombarded with hundreds, if not millions, of different interactions that are compromising the mitochondria, which are the powerhouse engines of our cell. And then we also have inside the cell, the nucleus, the cytoplasm, and all of its organelles. And so, you know, a cancer cell is birthed because a normal cell in the right conditions can become, a normal cell in abnormal conditions can become a cancer cell. So these inciting mechanisms are the body and the cells are acidic. And when you have acidity, because your pH of your normal blood is about 7.43, when your body becomes acidic, you immediately have hypoxia. And when you have hypoxia, which is low oxygen, anaerobic metabolism, you have fermentation of sugar and you make lactic acid, and everything grows and all the toxins cannot be disposed of in your body. And so you have this going on, and I tell people from one cancer cell to tumor is about 8 to 10 years in the conventional world. So we have so much opportunity to prevent it. And, you know, my number one goal would be to prevent diseases, all diseases, but the community isn't interested in it, and doctors are reactive. They're not preventive, precise, and personalized about their care. And we're not taught in medical school. We're taught to treat. And I tell people we need to fix patients so that they can conduct productive lives. And so people don't realize, like, I had a patient who had a brain tumor recently, and she'd gone to Cedars-Sinai. And the doctor told her, oh, this just started 3 months ago. Well, no cancer, no heart disease situation just starts a couple months ago. This is many years, metabolic, mitochondrial assaults to the body. And so we have to change the environment of the cell, all right? And the mitochondria, now mitochondrial medicine's like big now because, you know, everyone's talking about it. But this is something that I've been focusing on for, you know, over 25 years. And so my treatments are very different because I'm trying to change the cellular energy of every cell. And so, you know, people don't realize that when the body is acidic, and then you want to know, well, what's causing our body to be acidic? Okay. We have a beautiful buffering system. Okay. We have an amazing buffering system, but now we're being bombarded with so much pollution. So I tell people we're living in the great poisoning, the air, the water, the food supplies, literally everything that we are utilizing and doing and drinking and eating has potential toxicity. Then you look at the nutritional deficiencies. Even if you eat perfectly, it's probably very difficult to have 100%, you know, vitamin sufficiency. And then you have a lot of the patients have viruses. If you think about all the viruses that cause the infectious part of cancer, right? Like Epstein-Barr cytomegalovirus, mycoplasma, I mean, a lot, herpes virus, all these different viruses contribute to an inflammatory infectious process. Even like, for example, pancreatic cancer. I mean, a lot of it is, obviously there's many things, but one of the infections you should be checking is H. pylori, because H. pylori can contribute not only to stomach cancer, but also pancreatic cancer. So when we look at a patient, we're looking at everything that could be contributing to the perfect storm. And so what I really see is that patients, I go through a very detailed analysis from the time they were conceived to where they are now. And I do an exhaustive analysis. I go through birth to 10, 10 to 20, whatever age they are. Then I go through exposures. I go through, have you been exposed to mold? All these questions, because everything matters. And then I go through a detailed lifestyle. How much do you sleep? 50% of the population doesn't sleep. Well, sleep is the elixir of life. What water and what kind of water are you drinking? We have to drink purified water. We have to eat foods that nourish, strengthen, and heal the body. We have to avoid insecticides and pesticides. And I'm going to tell you, it's impossible to avoid them completely because they're everywhere. I mean, look at glyphosate alone. I mean, there's 170-something thousand lawsuits against Monsanto, now Bayer, on glyphosate poisoning. Okay. And now they're trying to get exempt from, being, it's causing that. So we can't allow that to happen because look at glyphosate, it's horrible. And what percent of the population has glyphosate? Probably over 95%. And so then you have to look at the body if they're moving. Like a lot of people aren't moving enough. We have 800 muscles. Exercise produces energy. So oxygenation, lymphatic tissue, et cetera, helps the immune system. And then one of the biggest questions that doctors don't ask is what's going on in the mouth. And the mouth is the gateway to many diseases. And we used to use mercury fillings. Now we don't. Mercury is a very serious toxin. If you have a root canal, it's a chronic infection. If you have periodontal disease, it's chronic infection. Chronic infections suppress the immune system and cause chronic inflammation. And then we have to look at stress. And I usually ask patients, so tell me what has been your stress for the past 8 to 10 years. And I will tell you that, and stress is part of life, and stress makes you strong. But it's extraordinary stress, okay? So I really ask deeply because rarely people don't have they always have some extraordinary stress. And so like, for example, if someone's diagnosed with breast cancer, usually you ask them, okay, how long have you been married? And who in your family, like that you don't get along with? Like I had a 40-year-old the other day come in and her mother was there, her husband was there. And I said, tell me about your stress. And she kind of like, well, I don't really have that much stress. And then the mother piped in immediately and said, well, you kids are trying to take over the business, meaning not take over in a negative way, trying to learn the business so they can take it over. So we've been doing that for probably the past 6 years. And and they're, the father's saying, look, I want to retire, right? He wants to rest and he's trying to give it to the younger kids to, transfer the power. And so then I said, okay, do you have any brothers and sisters? She goes, well, I have a brother. And I said, are you very close to the brother? Yes. And I said, how is he doing? Well, he's had a meth addiction for 10 years. So here is, unspoken, like really not probably talked about, not conscious of like, how is this possibly affecting me? And so you really, that's why I believe emotional work has to be part of any healing program, whether it's cancer, heart disease, or any other medical problem. In fact, we added that to our physicals now. So when you're a new patient here, we always do something called EVOX. Vox is the Latin word for voice. So your voice is a frequency. And so you just start talking about yourself and the frequency is displayed on a computer and it tells the practitioner the things that need to be reframed or transitioned. Because I tell everyone that an emotional dysfrequency is stored as unfavorable in our body. And so breast, for example, is unrest in your nest. And if you have lungs, that's grief. If you have pancreatic cancer, someone's stolen your joy, etc. And so there was a very famous German doctor. His name was Dr. Hammer. And Dr. Hammer developed cancer himself at the age of 50. And he's like, wow, why do I have cancer? And he was a conventional doctor in Germany. And so then he started asking all of his patients, well, why do you think you have cancer? And they would say, well, this happened to me and this happened and this happened. And so he developed something, what we call here in the United States called recall healing. And then other people have called it different things, but he would talk patients out of their cancer. And he had a very high success rate. Of course, he went to jail for this because it went against the conventional paradigm of medicine. But he had a very high success rate, continued to live till he was about 86. And anyway, so I studied that because I saw physicians presenting that at a conference many years ago. And I go, wow, this is really impressive. And so they call it German New Medicine. If anyone wants to look it up, it's called German New Medicine, and they're Hammer practitioners all over. So we basically incorporate that into our part of our, healing protocol for anything, whether you have cancer, whether you for example, I was reading an anti-aging, a friend of mine who runs something called the Genius Network. And he sent me this article on okay, everybody's into biohacking for longevity to live forever. And so this guy he's the abundance guy. You may know him, Peter Diamandis, right? And he's talking about it. And he's a doctor, but he's never practiced. But anyway, so I'm reading this article in the New Yorker, and it's talking about, okay, get this scanned and that scanned and do this testing and, all these kind of testing. And I'm like, wait, this article's not talking about the spiritual, emotional facets of a human being, which is just as important as, whether you have vitamin D, sufficiency, or whether you have high hemoglobin A1C, or if you have a fatty liver. Your emotional, your emotional, spiritual state is just as important. And so I think it's a big missing piece in our medicine today. And I think now, though, it's being talked about a lot. In fact, my patient today, who is an ICU nurse, she said, I've listened to all these podcasts and they all are saying the same thing, how stress and emotional conflict is contributing, to disease. And so, in my lectures, they've been talking about stress contributing to illness for hundreds of years. It's just now we're in the forefront. And I'm so excited because we're in exciting times. They just built the first medical school. I don't know if you saw that in Arkansas. Okay, I'm like, whoa, okay, this is going to be great because I'm going to have a pool of doctors to pull from, because trying to find doctors who have the understanding of integrative functional medicine is not easy to find. And so now we're going to have, there's a medical school that's going to be, really producing doctors who understand healing from gardening and addressing stress and emotional conflict and all these wonderful things that we're talking about and what your podcast is talking about. And so, so there is a major up-leveling and transformation for humanity that is happening. And it is happening so fast. It's just so exciting. So I feel really good that after 39 years, everything I've been talking about, for example, plastics, I started talking about plastics literally 35 years ago, and people thought I was crazy. In fact, one of my patients told her neighbor and said, your doctor talks about plastic, that she's kind of crazy. And then, of course, Barbara Walters did a special on it, and she talked about plastics, and then everybody believed it. But anyway, we've got to wake up and listen. I don't know if you've seen the book, Rachel Carson, Silent Spring, written. Yeah, so that book. She talked about this. She tried to get everybody's attention. So we all, as individuals and collectively and the community, really, really need to help each other be the best version of ourselves. And it starts with your health. Because if you don't have your health, you never realize it until you don't have it. And I tell all the patients, there's no new healthy body for sale on Amazon. And so you've got to respect and learn everything you can to take care of your health. And your health just isn't physical health. I was talking to you before. It's a spiritual, emotional, intellectual, biochemical, biophysical, and bioenergetic being. And we need to really understand that. We don't ever have that opportunity to say, how do we really work? And not just anatomically, but I'm talking about the 50 to 100 trillion cells and 100,000 chemical reactions per second, how that's playing. And then we're living in this petri dish that we really don't even know all the facets of the petri dish and the interactions in the petri dish. So, like, one of my pet peeves is electromagnetic fields, right? And so, my daughter, when she was, my daughter, Alana, and she was in 8th grade, she's 31 right now, but she was 8th grade. And I said, oh, you know what? I have a great science project. How do electromagnetic fields affect a living substance? And she got an award for that. And so, there's now so much science and so much validation and so much chemical validation. It is a very serious issue, and we have to be mindful. We've got to do, proper care of phones and iPads and Wi-Fi and all this thing. And really, nature is your healer when it comes to that. And so we just got to really listen to all this. And I always say that health is a secret because you want to look up things, you have to go down deep. And so that's what's so beautiful about podcasts like this is like you're getting the latest, greatest on what, is really important. So I appreciate that.
Yeah, I mean, one of the things your program has is that's sort of special is maybe you could talk about it, the electromagnetic aspect of the voltage therapy that being as applied to cancer. Maybe speak to that if you don't mind.
Right. Yes, that is a big chapter in my book. I don't know if when you have time to read about it, but that's very fascinating. So one of my friends is Dr. Tennant, and Dr. Tennant's an ophthalmologist. He's probably 87 now. And so I personally, as a patient and a doctor, I'm like, I'm going to go fly and see him. And so I had 14, and when I was 6 years ago, I had 14 hours of back surgery and 4 hours like 3 months later. So anyway, so I thought like, I really need to optimize myself. So I flew out to see him, and he taught me really literally everything about voltage. And then of course you continue to learn, because once you learn something, it never stops. And so every one of our cells emanates 0.07 millivolts of energy. You have to have minus 25 volts for your cell to function. And so if your voltage or the energy, just like a battery has to have energy for it to work in your flashlight or anything else that you have. And so when your voltage is low, your body can't take care of itself. So what makes your voltage low, all right, is what you really want to ask. So toxins make your voltage low, EMFs make your voltage low, nutritional deficiency, bugs, viruses, bacteria, fungi, and parasites, heavy metals, acidity will make your voltage low. In fact, that's one of the things in chemistry. When your pH goes down, your voltage goes down. Your oxygenation will go down also. And then also like scars and tattoos. People don't realize that scars, once you get a surgery, that it blocks all the acupuncture meridians, which are part of the electrical wiring system of our body. And so we now, just like how I learned it when I went to work with Dr. Tennant, and my voltage was low. So now what do I do? Very focus on providing the energy. And it's not energy to go run, it's the energy of the cell. And so I do different therapies. If you ever come and visit, you can see all the frequency devices that we have. In fact, it's becoming much more popular now, that of energy things. And so we check the voltage using something called the Meridian Energy Assessment Device. You have meridians. Meridians are acupuncture points, and they're like a wire or a string of pearls to your organs and glands. So we look at the flow of energy, or qi in Chinese medicine, see what it is. And then we want to, unblock all those, but also we want to provide energy immediately to the cells. So all of our patients we use biocharger and we use biomodulator and I also use a device called Cellsonic that's from Europe. And so we use all these things to really charge. That's why when any patient comes here within a week, they feel so much better, especially the cancer patient. They feel so much better because their literal energy, and then the energy of the cell is very important. One of the things what you can do to increase your voltage of your body, immediately get in nature, get your feet barefoot, your electrons, you get electrons from the Earth's magnetic field. So you want to ground. It's, it'd be nice to ground, take off your shoes in the middle of the day and go walk out barefoot or on sand. Just, it has to be a natural substance that's connected to the Earth's magnetic field. And so that's another good way to do that. Being around running water, trees, sunshine, all those things help. But of course, sometimes we need a little other help, like that's why I have patients do other things to help charge their body, especially if they've had very serious challenges to their health. So it's a very unspoken thing, but people don't understand, when you do an EKG, it's an electrical assessment of the heart. If you do an EEG, it's an electrical assessment of the brain. When you do nerve conduction studies, that is the electrical assessment of the nervous system. So, and then people just, you have, like I was reading not too long ago about how cells, there's that energy between the cells. They know how to talk to one another, okay? Because that magical membrane, it has its own voltage. And so we've got to make sure that our cells are charged with all the right nutrients, all of the right, like the membrane, like you've got to have phosphatidylcholine and essential fatty acids, okay, for that membrane to be healthy. And so, but you've got to get rid of all the toxicity that is in the body. And it's way, it's interesting. Patients, they always look at me and they go, "Am I toxic?" And I said, well, we're going to do a test that proves that you have toxicity, because most people really are in disbelief. Like, you really think I have toxins, And so anyway, and so I do like environmental toxins and heavy metal toxins, but also when you're growing parasites or fungus or any other bug, they have their own metabolic activity. Okay. Like, for example, fungus produces acetaldehyde, okay, which is the byproduct of alcohol. You feel awful. Okay. And there was a gentleman that I met, I would say a year or so ago, and he came up with the cell suppression theory of cancer. And he had cancer himself. It was an unusual form of cancer that involved the muscle. And so he took a deep dive. He has no medical background, but he read and studied, and he wrote a book called Cancer Resolution. My book's Cancer Revolution. He wrote a beautiful book about how fungus is probably the biggest cause for cancer. Now, of course, we all know there's many other things, but in his theory, he does a very, very good job. And he got 200 scientists and MDs listened to him and gave him a very high rating. So we have to really look at his work, because it is a big part of the contribution of cancer. I mean, you talked about the metabolic and the mitochondrial theory, but the fungal theory. Now, years ago, I will tell you, I was going to be interviewed on a TV station in Texas, and I met Dr. Simoncini. Now, Dr. Simoncini, he's an Italian doctor, and I'd never met him before, and he was there, and he started talking to me, and he wanted to show me all of his cases. So he pulls out his computer, showing me all of his cases, how he injected sodium bicarb in tumors and in the body and all kind of things. And he created a website called cancerfungus.com. And I'll never forget it. I mean, because I started looking at fungus 25 years ago when I met him, saying, oh, that's another thing I got to look at. And then I had a doctor, a gastroenterologist. She was the only guy who lectured at the American Academy of Gastroenterology, lecturing on parasites. And I'm like, okay, we took that in medical school, but I don't remember that much, And in the US, doctors don't think you have parasites. So anyway, he taught me, he's still in Santa Monica. And so he taught me, but then it made me go deep, deep, deep dive. And so now we have a whole nother way of just diagnosing and treating parasites, way more than what he taught me. Because you have to learn that, and then you've got to take it to, anything you learn, you've got to keep learning about it. And so now, you see how many people have parasites, and I will tell you that most people have parasites. It's a big problem. And doctors, I guarantee you, they're barely teaching it in medical school now. And so, I was reading and I sent it to my doctor staff about like this little 12-year-old girl went swimming in a swamp or a lake rather, and she got a parasite in her brain. And they said from the water. Now, we can get parasites anywhere. You go out to eat, you can get parasites. Contaminated. Look what the recalls, but look at the recalls they don't find, right? So you've got to be protective, but I will tell you, with our immune systems as challenged as it is today, we probably all have probably some parasites and then fungus. A lot of people have fungus because why? They've all taken antibiotics. Like everybody, doctors give antibiotics, patients want antibiotics, even though they probably shouldn't have them. But anytime you take antibiotics once, what do? You destroy your microbiome, which is 80% of your immune system, and you grow fungus. Not 100% of the time grow fungus, but you grow fungus. If you're pre-diabetic or diabetic, you're going to grow fungus because they live off of that. They live on fungus like sugar. And so how many people, a lot of people say, there's 95% of people metabolically unhealthy, right? I'm sure you've read that in all your reading. So fungus is something I see, and there was a famous book you should look up called The Yeast Connection. Do you remember that book? It was written a long, long time ago. In fact, I was going to look up what year it was, and he talked about the yeast connection. And so people have yeast, and absolutely you can figure out on testing if people have yeast. There's actually a way, because people, if I do a lot of bioenergetic testing, and so I can tell because it's less expensive and you want to find out lots of information fast. And it's not something I learned in medical school, you learned in medical school. And when I went to a conference and they had it, I thought, whoa, this is woo-woo for me. So I was like not interested because it was like not in my comfort zone. And then of course it comes in your path again. And I'm like, okay, I need to learn this. And so then, many years ago, I learned, and I'm like, oh my gosh, this is indispensable. Because, when you get your blood work done, okay, how accurate do you think it is? How accurate do you think it is? Okay.
Yeah.
I mean, the labs aren't always accurate. Okay. So you scans, are scans perfect? No, you're a radiologist. Scans aren't perfect. Okay. Are they great in identifying things? Absolutely. But I always tell patients, it's never what a doctor sees, it's what we don't see. So I am always want to look for the invisible in patients. And so because that is, where you're going to find the treasures of a lot of what's wrong. So the lump or bump on a patient is just the top of the iceberg. What lies beneath is where the doctor should be looking with any disease, if you have heart disease, calcifications in your arteries. Rob and I were just talking about the calcium score, which I have been doing on my patients for, I don't know, over 30 years. And so, because I don't want my patients to have a heart attack, but it's 50% of cases, the number one symptom, what? Sudden death. So who wants that for somebody, right? And so I've been doing calcium score. I don't have in our whole clinic one heart attack a year in our clinic, okay? And if patients follow us, they don't get cancer either. So in fact, I'm compiling that number as we speak, the amount of people that come here for prevention. And so, we have all the information right now to prevent disease, prevent suffering, to provide precision medicine, to provide personalized medicine, because medicine's becoming very personalized now, right? Through all kinds of texting. If you look at how people methylate, like that's an important part of our workup is methylation, right? Because it's how your body is processing DNA every day. And if you have a methylation defect, then you've got to address that. And you've got to look at the different genes that's associated with and customize. And 1 out of 2 people has it. So why isn't everybody checked, right? In fact, they even have a prescription medicine that is a vitamin for that defect, for MTHFR, right? So why, if it's 50% of the population, why isn't that like standard order for everyone? Because you would change the trajectory of their life if you fix their methylation issues, right? So anyway, and then, one other thing I talk about is the immune system. And, people, it was interesting. There's a guy at that I don't know where he practiced. He's originally from South Africa. You probably know who I'm talking about, but he's from South Africa. He was a transplant surgeon. And then, he's been talking about everything's the immune system. I'm like, wait a second. The immune system's been part of the body for a long time. And so we have to look at how your T cells, B cells, natural killer cells, all your immune cells are working, because whether you're dealing with aging, cancer, heart disease, autoimmune, any other disease, we have to look at the immune system. And so, it's things that we think are groundbreaking. They're really not groundbreaking. We just thought a drug for every ill was going to be the answer to our, medical problems, and it's not.
Yeah, so such a good, important points. And I want to be respectful of your time. I know we have a hard stop coming up. Boy, people have written in to ask questions, but I've only got time for one question. Probably one of the most popular questions people asked me to ask you was, given the high number of patients who've had cancer survivors, they're recovering, they're past their cancer. The question was, living a healthy lifestyle, are there anything they shouldn't do that other people should do? In other words, any supplements they should avoid as a cancer patient, or anything they should do differently? Obviously, everything is personalized, and when we get in, but just as a global recommendation, is there any recommendation?
Well, I talk about this in my book, but I will tell you, we have to honor the rules and laws of our body. Okay. So sleep is paramount, 8 to 9 hours. You have to drink purified water. You have to eat foods. You've got to buy organic foods, and you've got to eat foods that are the rainbow. Okay. You got to have some protein. You got to have some fat. You got to, use all the vegetables and the fruits instead of like buying pasta, which is not a vegetable. Okay. And then you've got to move. Most people are not moving. You've got to move your body, because exercise and having muscles are amazing for longevity. Okay. And the amount of things exercise does to your body is endless. Okay. And I'm not saying you have to run a marathon or do a triathlon, but you've got to move, take every opportunity to move, like enjoy washing dishes, washing clothes, any reason to move. I would recommend that you do that. Then I would tell you to take inventory of your stress. Now, it's very hard to do alone. So be vulnerable and ask your best friend, do you think I'm stressed? Do you think that there's something bothering me that I haven't really given attention to? Because what I've learned in 39 years is that emotional conflict results in the body. And that could be anything that you can think of. And we inherit not only the time we live. If you read the book, The Body Keeps Score, we go back 15 generations. And that's I learned that from Gabor Mate, who's a famous psychiatrist, and he's amazing. And so really do self-introspection and learn how to be happy inside, because happiness is an inside job, not an outside job. And learn how to turn everything that's unfavorable in your life into good. And it can all be done like that. And that is like critical. Now, one more thing is that you can detoxify yourself at home by making an Epsom salt, baking soda, clay bath. Okay. You can bake coconut oil put it on your body, and coconut oil, castor oil, all these things I talk about in my book. But we do have to cleanse every day, unfortunately. A bath is easy to do. Plus, it's very relaxing to the body. And if you know of Epsom salts, it's named after a city in England. And Epsom salts are magnesium and sulfate. So magnesium is involved in over 400 chemical reactions in your body, poorly absorbed orally. Sulfate is part of a lot of the biochemistry. And a lot of people have sulfur deficiency, so you can't detox if you don't have sulfur. And so then the clay nature uses clay. Animals use clay to cleanse themselves. So just that, and then you get to relax because you could be listening to classical music, solfeggio frequencies, or anything to calm your insides.
That's wonderful points. It's so important. I want to thank you so much for spending time with you. We're going to put your contact information in the show notes, how people can find out about your clinic and get involved there as well. And are there any last points you want to make before anything we didn't talk about before we wrap up?
Right. Well, I think we need to all focus that health is our number one value. Yes, you might have other values, of course you do, but if we all focused on trying to attain health, which is, believe it or not, physical, mental, and emotional, social well-being, believe it or not, that's the definition. If we all did that, try to learn everything that you can. That we're in the era of information overload, right? So even if you listen to 10 or 15 minutes of something, you're going to get a pearl. And really take care of yourself and never give up on yourself and never give up on anyone else.
Thank you so much. We've been talking with Dr. Leigh Erin Connealy. Her new book is The Cancer Revolution. It's out now. You really got to get this. You got to read it. Thank you again.
Thank you.
If you are enjoying this program, please hit that subscribe button, or even better, leave a review. Your support makes it possible for us to create the quality programming that we're continually striving for. This episode is brought to you by L Nutra, maker of the Prolong Fasting Mimicking Diet. Use the link in the show notes for 20% off. What if your routine CT calcium scan could tell you even more? Now from a single scan, you get 4 powerful reports. Not just your coronary artery calcium score, but also your arterial age, liver fat levels, and bone mineral density, with no added radiation or time. Spotting heart disease, metabolic dysfunction, and bone loss before symptoms begin. And now it's available anywhere in the US, no prescription needed. Use the code LUFKIN20 for 20% off.
Can I start? Is it recording?
It's already recording.
Oh, sorry. Okay. This is for general information and educational purposes only, and it's not intended to constitute or substitute for medical advice or counseling, the practice of medicine, or the provision of healthcare, diagnosis, or treatment, or the creation of a physician, patient, or clinical relationship. The use of this information is at their own user's risk. If you find this to be on the value, please hit that like button to subscribe to support the work that we do on this channel. And we take your suggestions and advice very seriously, so please let us know what you'd like to see on this channel. Thanks for watching, and we hope to see you next time. You should say that.
No, that's good. It's for you to say it. I think that's very good. You like it? You want to do it one more time, or is that good? I think that was good.
Yes.
All right.
You need to save the recording.